generally the most common type of assisted reproductive technologies is in vitro fertilization. And when you look at all the variables, the one that is most predictive of who's going to get pregnant is the patient's age. For instance, if you take the national data on in vitro fertilization, women under 35 in the most recent statistics have about a 42 or 43% chance of going home with a baby for each cycle that is started, whereas patients over 40 years old have only a 5% or so chance of going home with a baby if they start a cycle of in vitro fertilization. So the age is by far the most important factor. There are some other factors that do affect the success rates, none nearly as much as age, but certain things, for instance, if the sperm from the male has to be extracted from the testicle, there seems to be a little lower success rate than if sperm is ejaculated. There are some women who have certain hormonal issues that does decrease the chance of getting pregnant, and certain ethnic groups have a lower success rate. And very importantly, and probably a predictive factor that again is not as much as the woman's age, but very predictive, is the woman's weight. The higher the BMI or the higher the weight of the woman, the lower the success rates for in vitro fertilization seem to be.